Botulinum toxin, which is the generic term used to describe all of these injectables that we use, whether it's Botox or Dysport or Xeomin, is a wonderful adjunct in our armamentarium to improve facial beauty. The drug works by relaxing muscles of facial expression. So some of us are a little less expressive, some of us are more expressive, whether it's use of the brows or our frowning muscles or smiley laugh lines. Botox works. It's a wonderful treatment option that is done in the office. Typically takes about 10 or 15 minutes. It's painless and you go about the rest of your day without any difficulty. The results last for about 3 to 4 months. So patients will come in usually 3 or 4 times a year and come in for their 15 minutes. It's excellent for treating the dynamic lines. We call them the dynamic lines of facial expression. Some patients will ask us if it'll treat, the furrows around the face or other areas where they want to have more volume. So no, Botox doesn't work for that. It's for the dynamic lines of facial expression, and it certainly is excellent as a preventative as well as something that can restore and treat lines that have established over decades. We typically get 2 sets of patients who are interested in botulinum toxin injections. The first group is the younger patients who are looking at preventative Botox. It's used when you're a very expressive person, whether you're thinking a lot or smiling a lot. The Botox will relax those muscles, and it certainly has been shown in many studies that it helps with rejuvenation and it prevents deeper lines from forming over time. The second group of patients are those that have already developed those furrows. They've developed the 11 o'clocks, they've developed the deeper lines around the eyes or bands around the neck. And for those patients, we use slightly higher doses, and it certainly is a great adjunct to laser therapy or surgery when needed, or even as an independent treatment on its own. It's a wonderful, wonderful intervention. Botox injections are painless. They're in office. They take about 15 minutes. So most of our patients will come in their lunch hour or right before work, and then they're back going about the rest of their day. After the treatment's done, you typically have almost no visible signs that anything was done. If at all, you'd have a little bit of redness that may last for a few hours.